Right, our vaccine mandates for many sectors will be done away with as of 11:59 tonight. It comes as Cabinet meets today to discuss a possible move in the traffic light settings. For more on this, we're joined by Prime Minister Jacinda Ardern. Good morning, Prime Minister. Thanks for being with us. So, Morena, if we move from red to orange, which would be the next step in the traffic light setting, how many more cases would that add to hospitalisations?
Well, the first thing I'd say is this is just going to be part of a regular review cycle. So it's not that there's any particular thing that's triggered a review. We are just going to regularly undertake a review of our settings. The point, I think, of moving is less about the number of cases, but more about, as you say, hospitalisations. And so the idea is to move at a point where we believe that our hospitalisations have stabilised and that even if there were a small number that might be contributed, it wouldn't have an impact on our hospital system. Very difficult to model that. So that's why instead we look at where we are right now and say if we were to make these changes, do we believe we have the capacity in our system to operate normally and to be able to continue with regular healthcare? Okay. At the moment, though, we do have quite a bit of pressure in the system still. In Auckland and Wellington in particular, we've seen cases come away, but in other areas we're only just starting to plateau in terms of hospitalisations or are still increasing. So okay. That's the environment we're making these decisions.
So an indication there in terms of the health response, then you don't feel it's quite time to go to orange right now?
Well, certainly in some parts of the country. So we do have the ability to take different approaches in different parts of the country, though. You can have
Auckland,
different settings in different
for
places.
It certainly seems like the curve is on the downward trend in Auckland, so there may be regional differences in Auckland?
It certainly is on the downward trend in Auckland, and that is a possibility. But we need to also take into account that this is about our hospital system, and our hospital network often works with one another. And so, look, that's something Cabinet will consider today. But we will be careful, we will be cautious.
Of course, although I guess for small and medium-sized hospitality businesses who say with the seated and spaced, the 200 inside really has made no difference for them. Until the space goes away, they can't actually get back up to normal operating. There's bars and nightclubs and all those kinds of businesses that depend on people being able to come in and stand up and mingle. How much longer are those businesses going to have to suffer?
Yeah, and so you're right that is the most significant difference, of course, is gathering limits and the requirements around being seated and separated. And you're right, in some places, where they may be a smaller venue, they're able to have as many customers, but the fact they're having to separate them out is the thing that's reduced down their capacity. But we've done that for a reason. It is because we're trying to reduce down transmission when you have cases around so that we don't keep a growth in our hospitalisations. So we do know that it is having that impact. But what we also need to factor in is making sure people feel confident. Moving to orange is a sign of confidence that you're in that phase where we're not having that large impact on our hospitals. That is often a reflection of what cases are doing. And we know in some places, actually, hospitality may be fully operating, but they might not in some places see the same patronage as usual. Yeah. So we need to get that consumer confidence back as well.
Yeah, although I think people seem to say that they're happy to go out. It's just businesses are still very much affected too, I guess, by staff needing to be off. Let's talk about another health issue that is of concern. And last week on the show, we asked you about the backlog to cancer care and specifically around response times for breast cancer screening. So just as a reminder, this was your response to those figures.
Be keeping pace with what we've seen in the past. Look, in terms of screening, there are a mixture of whether or not people were coming and accessing and its availability. I'd want to go away and just double check on that because the Cancer Control Agency again has highlighted, with the exception of August last year, the numbers have been keeping pace with what we would expect.
Okay, well, the CEO of the Breast Cancer Foundation rejected that and got in touch with us after that, and this was her response.
Oh, we strongly disagree with this, Brian. We've been writing to the government for over 6 months now. We now know that there are 50,000 women overdue for their screening mammogram. And what this means purely on the numbers, of those 50,000 women, we estimate that 300 of those women could have cancer.
So, Prime Minister, are the numbers being fudged to make it look like there is no backlog?
No, not at all. And I did say I was going to go away and have a look at the screening, because what I was talking about in that interview predominantly was diagnosis, because the Cancer Control Agency
so what's
had gone
happening
away
in the
and done some
then?
analysis up until, I'll just finish there as well, because there's a little bit extra that they need to report on. What we can see is that we've got up until Omicron, we have some analysis from that Delta period around what we'd expect on diagnoses. So we do need to still see the diagnosis
it's not
reporting
actually,
from
the Cancer Control Agency says it's still not what they expected, because it said the overall impact of COVID-19. I just want to correct what the Cancer Control Agency
I genuinely want to answer
said.
your question. So if I might speak to the screening issue.
We were going to speak about screening, but you were talking about the Cancer Control Agency. So I just want to say what they actually did say in December, which was that the impact is considerably smaller than the disruption seen in April and May of 2020. But they are saying that there has been an impact, and this is what the Breast Cancer Foundation is saying too. So it just, with the government saying on one hand that there is no backlog, and Breast Cancer Foundation saying that there is 50,000 people overdue, there's a discrepancy.
Sorry, if I may, there's really not. What I was trying to acknowledge was actually during level 4, yes, we didn't have the same level of screening that was being undertaken because many health services weren't operating at that point. And so at now, in the COVID protection framework, we are seeing that the screening is available. Extended hours have been operating to make sure that even though they're using physical distancing and so on, they're still able to provide appointments. We do need a catch-up, though, because we're about 10% down on what you would otherwise have been seeing.
Okay,
so
but
we do need a recovery plan.
You were saying that
to catch up on what
the
we
system is available. The Breast Cancer Foundation said this is absolutely an issue with availability, that there are 50,000 breast screens that should have happened, which means there are likely 300 women out there who have cancer and don't know about it. You suggested last week that it was potentially due to people not going, but it's actually about availability.
No, well, actually, one of the things that we've had is feedback that people have been concerned about attending. So
that's certainly not what the Breast Cancer Foundation is saying, or what the feedback was from our viewers who said that they are trying to get appointments, but they're being delayed months.
So we do have an issue, of course, with the regular amount of screening that we usually do being up and running, but people who may have missed out previously because of level 4 environments also seeking to be screened. So while we're running extended hours, and in some localities they've done a great job of trying to catch up, and others, particularly those that were affected by level 4 for long periods, there is extra work to do. I've just been talking with some of our ministers around that recovery plan, and one of the things that they're looking at is, as we see some of the pressure on across the board around Omicron, that extra campaign around making sure that people are coming forward, because there is a mixture of two things. There are some people who may not have come forward because they don't want to access health services in this environment. So we know that that is an issue. For others, it'll be about making sure we have extra appointments on top of what we'd usually be doing. So yes, there's some work there to do.
There are,
I'm not going to make an assumption
surgery
of how
delays, there is 60% who haven't been getting surgery within 31 days of diagnosis. Are you saying that that is due to people not wanting to come forward for the surgery?
No. I was just speaking to screening, and this is where I do want to be careful. Last week I was speaking to diagnoses, and we still also need to wait for the analysis over this right up until February. We've got some of the data from the period of Delta, but we haven't got the most recent information.
Okay, so the Breast Cancer Foundation,
just if I can ask, across the health system, if I just might finish, please, there is no doubt that the issue of COVID has had an impact. It would have been a much greater impact had we not had the strategy we had. You look over in the UK, the NHS has not been providing the same planned care or cancer care that they otherwise would. The impact here could have been far greater. Yes, we do have catch-up to be done. Planned care is going to be a particular issue where elective surgery has been delayed. We're working very hard to get the health system back into, and this is where these orange and red decisions play out, get the health system back into the place where we can undertake all of that usual care.
And
but
so
it's
the
not
Breast
fair to
Cancer
say
Foundation
that people
says it
have
would
not been
cost
getting their
$15 million
cancer
for 1,000
that otherwise
extra
they might
catch-ups.
have.
Would you commit $15 million for that, for the catch-up? Because they've been saying they've been asking
It's
for
not
6
fair to
months.
say that this is solely a financial issue. It's not. It is often a workforce issue. The surge capacity that exists in our cancer care is for the screening that we have day in, day out. So when you've got that extra need, you don't necessarily have the workforce or the equipment to then do an exponential increase across that. Okay. So it is not just a matter of money. If it were, these things would be so much more straightforward.
Absolutely. Prime Minister Jacinda Ardern, appreciate your time. Thanks very much.